Go ahead.
Okay, we're going to do a head to toe. Before you enter a patient's room, you're going to make sure that there are no signs, flags, or precautions for entering the room. Also, when you go into the room, you're going to make sure that you survey the floor and make sure there are no fall risks or safety risks for yourself and the patient. And then once you enter the room, you want to make sure you give them privacy by shutting the curtain behind you. Hi, my name is Heidi. I'm going to be your nurse today. Do you mind identifying yourself by giving me your first and last name and date of birth?
I'm Alex Solid, 12/16/1974.
Perfect. And is Alex okay to go by for you, or do you want another name?
No,
Okay,
that's fantastic.
perfect. Just going to clean my stethoscope here. Today I'm going to be doing a head-to-toe assessment on you. But before we get started, I want to make sure that you know where you are. And do you know where you are?
Yes, I'm at Bellevue Rural Hospital.
Okay, great. And do you know what year and month it is?
It is July 2024.
Okay, great. I see that vitals have been attained. Patient is aware, alert, and responds to my voice and follows commands. I can see that the patient's face, eyes, nose, mouth, and ears are symmetrical, no signs of drooping, and A&Os have been completed. Okay, Alex, so before we get started, I would like to ask some health history questions. First of all, you said you were here for surgery follow-up.
Yes.
Okay, are you having any pain from that surgery?
No.
Okay, and any surgeries or hospitalizations prior?
No.
Okay, great. And then do you have any history or current symptoms of heart attack, chest pain, or shortness of breath?
No.
Okay, great. And then how about any cold or cough symptoms, any sputum?
No.
Okay, how about any nausea or vomiting?
No.
And any numbness, tingling, or dizziness?
No.
Okay, any constipation or diarrhea recently?
No.
Okay, and how about any abdominal pain?
No.
Okay, and do you have any changes in your urine, any frequency, urgency?
No.
And how about any blood or painful urination?
No.
And any odor or color changes?
No.
Okay, great. And then do you have any assistive devices such as like wheelchair? I see you have glasses.
Just the glasses.
Just the glasses?
Yeah.
Okay, any oxygen or incentive spirometers at home?
No.
Okay, and then do you use any tobacco?
No.
How about alcohol?
No.
And any recreational use like marijuana or anything like that? Okay, and do you have any anxiety or depression?
No.
Okay, any trouble sleeping?
No.
Okay, and then do you have any cultural or spiritual considerations that I should be aware of while you're with us today? Okay, and then last but not least, I do need to know, do you have any food or medication allergies?
No.
Okay, great. And then so as far as the surgery, you have no pain, but no pain anywhere else?
No.
Okay, great. Okay, all right. So we're going to get started with the head to toe. Again, patient is alert and aware. As I'm looking at her, her skin tone looks consistent with her ethnicity. We'll start with your head. I'm just going to do a quick evaluation of your scalp and the back of your neck. I'm going to touch your head. Is that okay?
That's fine.
Okay, great. So I'm going to have you lean your head forward a little bit. All right. Skin on the neck is warm and dry. Looks consistent with patient's ethnicity. There is no skin breakdown or no ulcers or anything like that. And on the head is very nice and round and symmetrical. No lumps, bumps, scabs, or scars. Okay, so next what I'm going to do is I'm going to do some cranial nerve assessment. So I'm going to first have you follow my light or my pin, and I want you to follow it with just your eyes, okay?
Okay.
This is cranial nerves 2, 3, 4, and 6. Okay, that was a good one, huh? Okay, and next I'm going to look at your pupils, and I'm just going to have you look at the wall straight to the back, okay? I'm going to shine this in your eye. Okay. Great. Pupils are round and equally reactive to my light. Okay, next thing I'm going to do is I'm going to have you close your eyes. I'm going to do a couple cranial nerves here. I'm going to do the cranial nerve 1 for smell, and then I'm also going to do 8 for sound. So I'm going to have you smell this and let me know what you smell.
Alcohol pad.
Okay, eyes closed still. I am going to have you tell me what sounds, or what side of your ear, your head you hear the sounds, okay? Okay. Perfect. Okay, so next we're going to assess cranial nerve 5 and 7. So I'm going to have you open your eyes and then give me a smile. Okay, great. And how about a frown? And then can you bunch your eye or squint your eyebrows in your eyes? Yeah. Okay, and then puff your cheeks out for me. Okay, great. And I'm going to have you close your eyes. I'm going to touch your face, and I want you to let me know where you feel it, okay? Okay, great. And then last but not least, we're going to do cranial nerve 7, 9, 10, and 12. I'm going to have you open your mouth and say ah. I'm going to check the mouth as well. Mucous membranes are pink and look healthy. And then go ahead and stick your tongue back out and move it back and forth for me. Okay, and then swallow for me. Okay, perfect. All right, and then I'm just gonna do a really quick look in your ears. Just wanna check the ears for any skin breakdown or any discharge or any sores inside the ear canal. Perfect, no sores. And then we'll look at this ear. Perfect, no skin breakdown. Skin on the face so far is consistent with patient's ethnicity and is warm and dry to touch. And last but not least, the last cranial nerve we're going to do is 11. So I'm going to have you shrug your shoulders really quick. All right, and then I want you to shrug them against my, okay, perfect. All right, so next I'm going to take a look at your neck. So I'm going to have you put your chin to the sky, and trachea is midline. And then turn your head to the left for me. Just look for jugular vein distension. No evidence of that. And then I'm just going to palpate your carotid artery. Okay, I'm going to have to touch your neck. Is that okay? All right. Perfect. Carotid artery bilaterally is consistent and even, and +2. Skin on the neck feels warm and dry to touch, and also consistent with patient's ethnicity. All right, so next we're going to move on to your lung and heart sounds, okay? So first I'm going to do an inspection of your chest, and then I will palpate your chest, and then I'm going to listen, okay? Can I touch you?
Mm-hmm.
Okay, great. I'm just going to palpate the chest. I'm going to inspect for crepitus. Okay, no signs of crepitus, and the skin feels nice and warm to the touch and dry. Also looks very healthy and consistent with the patient's ethnicity. All right, now I am going to listen to your lungs. I'm gonna have to kind of expose your chest and touch you with this. Is that okay?
That's fine, yeah.
Okay, I'm just gonna pull this forward. All right. As I'm watching the patient move and breathe, I can see that her respirations are normal. They're not labored, and I can see her chest movements are equal as the chest rises and falls. So you're gonna start about 8 points, start in the C shape, and you're gonna start all the way up at the clavicle here. You would listen longer because this is just a tutorial. We're not gonna listen very long. And again in that C shape. As you get lower, if the patient has a larger breast, you're gonna lift with the back of your hand, not the front. And all the way around. Perfect. Okay, lung sounds are normal, no evidence of any crackling or wheezing. And the skin on the chest feels normal and feels also warm and dry to touch. Next, I'm going to have you lean forward for me, and I'm going to listen to posterior lung sounds, okay? Mm-hmm. First, I'm going to palpate, actually, and also assess the back for crepitus. Okay, and no signs of crepitus. Again, the skin is warm and dry to touch and looks consistent with patient's ethnicity. Okay, and again, we're gonna listen to probably around 8 different spots, starting with the same spot up high. Again, avoiding the bones in a C shape. So you wanna avoid these shoulder blades here, all the way down and around. lung sounds posterior are also good. No signs of wheezing or crackling. Again, like I said, the back skin on the back is consistent with patient's ethnicity and warm and dry to touch. Okay, great. So next I'm gonna listen to your heart. It's gonna be a little similar to the lung sounds, but I am gonna only have to do a few spots, okay? So we'll start. I'm gonna use the diaphragm first. You're gonna listen to the aortic valve, the pulmonary valve, and to the tricuspid valve, and then the mitral valve. Okay, after you listen to those, you're going to flip it around to the bell, and you're going to go the opposite direction to the mitral, back up to the tricuspid, to the pulmonary valve, and to the valve. Alrighty. Everything sounds good. I can hear the loved up S1 and 2 there. No abnormal heartbeat sounds. Everything sounds pretty great. All right, Alex, so I'm just gonna go ahead and cover you back up. Everything sounds good so far. Next, I'm gonna assess your abdominal region. I'm gonna take a look first, and then I will listen, and then I'll palpate. Is that okay?
Sounds good.
Okay, so I'm just gonna expose your abdominal area here. Okay, and you're gonna check the skin for any distension, any color changes. Abdomen looks nice and healthy, no lumps, bumps, bruises, nothing like that. So far I can see that there have been no PICC lines, no IVs, no ports or anything like that. And no wounds or dressings or tubings that are in sight. I can see the patient doesn't have a Foley catheter. Otherwise, I would assess for that, inspect the perineal area for that. Abdominal skin is warm to touch. You could also inspect the bladder if there was indication for urinary retention. Okay, so now we're going to listen from the right lower quadrant all the way to the left lower. So right lower, right upper, left upper, and left lower. Abdominal sounds are normal. I do not hear any hyperactivity, or there is no like lack of activity, which would be hypoactivity. Everything sounds pretty good. So next I'm gonna palpate. I'm gonna start with the light palpation, and then I'm gonna get a little deeper, okay? Let me know if you have any pain. Any pain there? Okay. And there? Okay, great. And I'm gonna go a little harder. Let me know if you feel any pain, especially when I release. Let's rebound tenderness, okay? No pain? Okay, perfect. All right, as I said before, you would assess for bladder or for urinary retention with the bladder. You would assess, palpate the bladder and inspect as well the perineal area if there's a Foley. There is not. Okay, so we're gonna cover you back up. Next, we're gonna do your extremities. So I'm gonna pull your feet out. Is that okay here? Okay, sorry, it's a little cold in here.
All right.
Okay, so first we're gonna do your arms. I'm gonna have you start with lift your right arm for 10 seconds for me. Okay, and then you can lift the left arm. Okay, and then you're gonna lift both arms for me. And this would be for 10 seconds each. All right, and I'm gonna have you squeeze my hands. Perfect, and then flip your hands out for me. I'm just gonna get your radial pulse here. And your brachial pulse. Okay, radial and brachial pulses are even and consistent +2 bilaterally. Next, I'm gonna get the capillary refill. So I'm gonna check this finger, the ring finger, and the pointer finger. Should be less than 3 seconds, which is good. Nail beds look nice and healthy and pink. Okay, and then I'm gonna have you put your arms one more time up in the air for me, and I want you to resist. Okay, perfect, awesome. All right, and then one more thing, I want you to let me know if you feel this. Go ahead and close your eyes. And feel this. Okay, great. All right, so next we're gonna do your legs and your feet. Go ahead and lift your left or your right leg for me for 10 seconds. Okay, and then left leg for 10 seconds. Okay, good. I won't make you do both. Okay, so next I'm gonna have you put resistance against my hands. Okay, and okay, perfect. And then I am going to check the pedal pulses. And then I'm going to reach around and get the tibial pulses here. While I'm doing that, I'm going to put my thumbs on her ankles here to look for pitting edema, which is not evident. Okay. And then I'm also going to do the sensory with your legs. And I want you to let me know if you feel that. Close your eyes for me. You feel those? Okay, great. Last thing I'm going to do is I'm going to give your little toes a squeeze. We're going to check the capillary refill in the toes as well. And same toes as the fingers. Should be less than 3 as well, which they are. Nail buds look nice and healthy and pink. Okay, great. Skin on the arms and legs is consistent with patient's ethnicity and warm and dry to touch. Okay, so next we are going to get you up, Miss Alex. Do you feel okay to stand? Okay, so swing your legs here for me. All right, when you're ready, go ahead and stand. You're gonna have the patient close her eyes for 30 seconds, and she'll close her eyes for 30 seconds. And you wanna see that they don't sway or lose their balance, which, great, Alex has got good balance. All right, Alex, I'm gonna have you heel to toe walk for 5 steps, forward and back. As she's doing this, I will assess the back for any breakdown of any of the bony prominences, the shoulders, the back, sacral area, and buttocks, and then also the heels and stuff you'll want to check as well. Okay, so that's great. That's the end of my assessment. Do you need to use the restroom?
No, I'm good.
Okay, all right, and you can go ahead and climb back in bed. Do you have any pain after this assessment?
No.
Okay, and then do you feel okay in this position? Okay, and can I give you anything, any of your possessions?
No, I don't think so.
Okay, great. And then I'm going to give you this call light. If you need anything from me, just give that thing a buzz and I'll come running, okay? All right, I'm going to go ahead and clean my hands. And I'm going to go ahead and document all my assessment findings, okay?
Sounds good.
All right, I'll see you soon, Alex.